I'm Dr. Lean Fry, geriatrician for the Connected Senior Care Advantage program in Austin. And I'm here with Dr. John Notaro, the medical director for the Buffalo Medical Group. Through the Agilent Health partnership, physicians across markets are able to share best practices and collaborate with each other. Today we're discussing the importance of that collaboration. John, I can't tell you how the collaboration with Agilent Health has really made such a huge difference for my practice, my patients, and me personally, even as the leader of my practice. I've been able to collaborate with the physician leaders in Austin that I've known for years, seen them at multiples, the Travis County Society and all of that, and had great respect for them, but there just wasn't a business model around us being able to really put our minds together to develop clinical programs. Programs we knew would work, like house call programs. But again, Agilent has come in and allowed us to build those programs, and it's just been wonderful.
I agree, Liam. I think that the one thing that we've always lacked, I think we've always known what some of the important solutions would be, like what you're doing in your geriatric practice, but what we've lacked is the business model. We've lacked the ability to make larger scale investments, and we haven't had the right business model for the value of those investments to accrue back to the patient so we can reinvest in programs and reinvest in them.
I agree. And the other thing that's been wonderful, and I wasn't really expecting, was that I'm getting to meet you and hear what's going on in Buffalo, as well as what's going on in Columbus and California, Hawaii, and hearing the programs and the work that y'all are doing, and being able to then take the pieces of that with guidance from you all. You're actually helping me figure out what would actually be portable and work in Austin. And that is so professionally fulfilling, and it really gives me a tremendous hope and outlook for the future of geriatrics, both in Austin and across the country.
Yeah, the collaboration, I think, is going to supercharge what we do. I learned something from you today as you described your geriatric program and how you can really project clinical expertise into a patient's home, for example, for patients who are multiply ill and who are home challenged. And somebody in the room asked the question, would a primary care physician feel threatened by that? And what I learned from you was that it's not a question of feeling threatened. It's a question of realizing that I, as an outpatient prime, work in a system that can't quite project the influence into the patient's home that would be necessary to care for that patient. You, in your system, can, which makes us actually natural partners.
Exactly. Yes, I agree. John, it's been wonderful talking with you and collaborating with you today, and I look forward to continued collaboration with all of the physician leaders at Agilent Health.